along with menopause and perimenopause. Decreased duration of sleep has a correlation with heart disease. Not only that, fluctuations in sleep, awakening and falling asleep and awakening and falling asleep, also creates labile hypertension, meaning your blood pressure is up and down and up and down. That also increases the risk of heart disease. And then that estrogen level dropping as we age and go through menopause. Estrogen is cardioprotective. It provides some protection for the heart, which is why women have a much lower risk of heart disease prior to menopause than men. And then after menopause, our risk equals that of men. That is because of that drop in our estrogen level. So there's a lot to unpack.
There's a lot to unpack. So, I think I can imagine somebody hearing this and going, oh my gosh, I'm having hot flushes. I can't sleep. I can't stay asleep. It's very frustrating. I feel my heart racing out of control sometimes. So what do you say to people that are dealing with that, and where do you start? Do you need or should you have a cardiologist when you enter menopause? Should you at least have a visit or an annual visit? What do you do to kind of be proactive?
The first thing you do to be proactive is to find a physician who hears you and sees you, is not doing the proverbial there, you'll be better, this is all in your head, or it's just something you have to suffer through, or here's an antidepressant to make you feel better. Talk with someone who really gets it and is taking your symptoms seriously. Generally, this is someone who's certified, has a menopause certification. If your physician has this certification, then you know that they understand the connection of these symptoms and they are ready and willing to arm you with all types of therapies and techniques to help you move through this phase more comfortably. It doesn't mean that any other doctor who does not have this certification cannot do it, but for the most part, those who have this certification, you know that they have this level of expertise. And unfortunately, that does not yet lie with the cardiologist.
It has to be frustrating for you to hear people kind of make hot flashes and hot flushes, ha-has, and laugh, because you really understand there's a long-term risk involved. So if people are going through them, what is the duration that's too much, or the how often they happen? What is too much, and is there a too much and normal? I don't know.
There's not a too much, there's not a too little, there's not a normal. There's, some people, rarely, I haven't met anyone yet, I hear that they exist, people who have no symptoms during menopause, these phantom people.
Not me.
That I personally have never met, ever, but I read about them. So good for you. And then there are other people who have tons of symptoms, and then there's that in between. And so it is really all over the board. We do know that Black women tend to have more severe symptoms, they tend to start earlier, and they tend to last longer. And that may be due to what we call this weathering effect, meaning an advanced biologic age as opposed to your chronologic age, because of ongoing societal stresses, racial injustices, navigations in corporate environments that a Black woman has to face more so than other women, this weathering effect and this advanced aging. That being said, though, almost everyone is going to have these symptoms, and the longer they last, it seems to be the higher your risk of heart disease. Heart disease is related to the duration and frequency of the symptoms, so you don't want to ignore them. And certainly we often have been in groups where people laugh, people are ripping off their blouses or ripping off their jackets and, oh my gosh, I'm so hot, or jumping in front of a fan, and people laugh. But as a cardiologist, this is not a laughing matter. We've got to be able to connect what this really means for that woman's future risk of heart disease.
What can you do to take advantage of what is out there right now in terms of lifestyle changes? So, we're hopeful that it's not just women that are in menopause and dealing with this actively, but it's also women that are younger. I mean, I think that that's why you and I are out there talking about this. I think that's why we have so many voices out there that are trying to get the word out, because it's so that they're not in this exact place 20 years from now, right? So if you have somebody that's in their 30s, or they're thinking like, oh, menopause is a way off. Perimenopause isn't really a ways off. And perimenopause is when we see a lot of these more severe symptoms, really, or at least we're figuring out what we're going through at that point. What can people do in terms of a lifestyle change to help?
So true, Tamsin. And one thing to understand is, as women go through our reproductive years, pregnancies, if you have complications during your pregnancy, something called preeclampsia, eclampsia, toxemia, you may hear that word, hypertension, gestational diabetes. If you've ever heard any of these words, that increases your risk by twofold of heart disease as you continue to age. And so after your baby is delivered safely, you really should follow up with a cardiologist, because we now know that your risk of heart disease is twice as high as others. The other thing that we know is important for maintaining bone health is resistance exercising. I am a Pilates enthusiast, so I practice what I preach. I'm also a Pilates instructor. But any type of resistance training is very good to make certain that you can maintain your bone health, because the other effect of estrogen dropping is that bone resorption as well.
I didn't know you were a Pilates instructor too.
Yes.
I'm very impressed. I took up Pilates recently. I've always done yoga my whole life, but Pilates is a whole different, I love it. It's a whole different exercise, and I look forward to it. I don't go there like, oh, I go there excited about it, because I feel like
it's a little more dynamic. It's more movement than people think.
Yeah, and it's more of a challenge. Like, I feel like there's a challenge, and I'm kind of upping the challenge. Okay, good. I'd like to hear that. Is there anything else that I've missed that we should add on to this? Because I just think that the heart is not something we're talking about all the time, and I really want to prioritize that.
Have these conversations with your physician, with your physician staff, the nurse or dietitian, about what type of diet is really good for heart health, not just in menopause, but throughout your life. Because we know that cardiovascular disease, the development of heart disease that can increase your risk of a heart attack, has to do with chronic inflammation in the body. And we know that inflammatory processes in the body can also be very much impacted by this weathering effect that I talked about, which causes advanced aging, but also by our diet and the types of foods that we eat that can increase inflammatory processes in our body and accelerate not only the aging, but accelerate the advanced development of heart disease in our bodies as well. So menopause, if you haven't had a good diet throughout your life, menopause is a really good time to get yourself refocused and be on a diet that is really a healthy diet and is low in inflammatory foods.
Can you just list some of those inflammatory foods for people to avoid, so we have it, even if it's just a short list of the top ones?
Sure. Surprisingly, as far as vegetables, tomatoes can be inflammatory, believe it or not. For the most part, though, a diet that is high in fresh fruits and fresh vegetables, low in processed foods, especially any of these cakes and donuts and things that you get out of boxes, all of these things are processed. Types of foods that we pour in powders and mix up to create our dinner, all of these things are processed, increases the risk of inflammation. Red meats, fried foods, but interestingly, there are a couple of vegetables on the list, like tomatoes.
Yeah, that's interesting.
I'm reticent to say that.
I know, but I'm glad you did, because it makes sense. I mean, it's funny. I've noticed recently, as I've gotten older, the acid